How do kidneys handle renal clearance in physiology? Imagine your kidneys as busy filters, constantly working to clean your blood and keep your body balanced. But how exactly do they decide what to keep and what to toss out? That's where renal clearance comes into play. Renal clearance is a way to measure how well your kidneys remove substances from your blood and send them out in your urine. It tells us how effective the kidneys are at filtering waste and drugs. The process starts with glomerular filtration. Think of it like a coffee filter catching coffee grounds. Blood flows into tiny filters called glomeruli, which are part of the kidney's filtering units. These filters let water and small molecules pass through but trap larger proteins and blood cells. The amount filtered depends on how much blood is flowing through the kidneys, the size and charge of the molecules, and whether the blood proteins are bound to the molecules. Next is tubular secretion. Some substances are actively pushed into the tiny tubules of the kidney. Imagine a worker actively loading trash into a bin. That's what transporters do here. They move specific waste products and drugs from the blood into the urine. This process can be influenced if two substances compete for the same transporter, which can affect how quickly they are cleared. Then there's tubular reabsorption. This is like recycling. Some substances that were filtered out are reabsorbed back into the blood. Most water, glucose, and certain ions are reabsorbed passively, driven by concentration gradients and the pH of the urine. If a substance is reabsorbed, less of it ends up in the urine, meaning the kidney's clearance of that substance is lower. In clinical practice, renal clearance helps doctors estimate how well the kidneys are working. For example, measuring creatinine clearance gives an idea of the glomerular filtration rate, which shows how effectively the kidneys are filtering blood. If the clearance of a drug is high, it means the kidneys are removing it quickly, so the dose might need adjusting. Another tool is para-aminohippuric acid, which is almost completely cleared from the plasma by the kidneys. It helps estimate renal plasma flow, giving a picture of how much blood passes through the kidneys each minute. Understanding these processes is key in medical school because it helps us grasp how the kidneys maintain balance and how diseases or drugs can impact this system. If kidney function drops, clearance decreases, and waste builds up. Knowing how the kidneys handle clearance helps us diagnose issues and decide on the right treatments. So, in simple terms, your kidneys filter blood, actively secrete waste, and reabsorb what they need. This constant balancing act keeps your body healthy and functioning smoothly.